The most memorable event that has occurred here in this outpatient center can be described in 3 words: deadly, shocking, and impactful. This clinical experience has helped me grasp the full spectrum of the way I currently practice medicine. I remember being a routine, uneventful day. In fact, I remember thinking to myself, it was eerily uneventful. I was seeing patients with our 3 nurse practitioners. It was a routine, busy clinic day, and I recall between patients, I stepped back to one of the administrative offices to meet with a couple of my administrative staff. During this meeting, that peaceful, uneventful day was suddenly disrupted. The meeting was interrupted by a thundering, loud knock on the door and a loud, distant voice on the other side shouting, Dr. Montgomery, we need you quickly. A man collapsed in the lobby. I immediately went to the lobby, to the scene of horror and disarray. There were patients standing around with looks of terror, some crying, and one of my nurse practitioners were providing aggressive chest compression to the patient lying on the floor. A medical assistant was moving about frantically, attending to orders provided by the nurse practitioner. There were other members of the clinical team pouring into the lobby, attempting to assist in various ways. The patient was a middle-aged man. He essentially appeared to be a lifeless corpse lying on the floor. However, upon closer evaluation, I noticed that he was not just any lifeless corpse. I recognized the patient to be the older brother of a longtime friend and physician colleague of mine. He was essentially a family member. This new revelation added a new dimension to the event as I had to remain objective. This was one of thousands of code blues that I participated in. However, they're all unique. I went into what I refer to as the zone. This is a mental state of intense focus, concentration, and determination. This occurs to me whenever I'm faced with any type of a crisis, especially a medical emergency. I notified the nurse practitioner of my presence and I took command of the resuscitation efforts. I realigned the patient's body and positioned his head to open his airway. I ordered one of the administrators to call 911 and another one to clear the lobby of patients. I ordered one of the other medical assistants to take over chest compressions, and I ordered the nurse practitioner to get the code blue cart and the emergency medications. I ordered one of the cardiovascular technicians to obtain and connect the AED. I ordered another medical assistant to obtain an ambu bag to begin manual breaths between chest compression. I ordered the second nurse practitioner to start an IV in the right arm to begin infusing normal saline. All of these orders were provided in rapid succession, almost simultaneously. After connecting the AED, ventricular fibrillation was detected and 1 shock was delivered. Pulses were quickly detected in the neck and the right groin areas. Shortly thereafter, the patient began gasping for air, and within minutes, he was noted to be alert and answering questions. The EMS arrived shortly thereafter. I presented the clinical details to them prior to them transporting him to the hospital. While the patient was being lifted onto the stretcher to be transported to the emergency vehicle, I asked him one simple question. Had you been cheating on your diet? And he answered yes. I simply told him that things needed to change immediately as he was being transported to the emergency vehicle. A diagnosis of cardiac arrest secondary to primary cardiac arrhythmia was made. The patient was started on a raw detox diet and the defibrillator was surgically implanted during this time. Of note, this patient needed all that acute care medicine could offer. Nevertheless, optimal nutrition had a major role to play in his recovery. This clinical experience crystallized my understanding of how optimal nutrition can play an important role in the health of any individual, from the spectrum of wellness and prevention to that of being resuscitated from cardiac arrest. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.